of New York.
I just want to say thank you, Mr. Chairman and Ranking Member, and also thank you to all of you on the panel and for your hard work in this really important area. And I think that we're handling in Congress. And I appreciate some of the comments addressing the many people. I'm from New York State, and I live in one of the more rural areas, way upstate. So everyone thinks that we're all New York City. Well, we're not. We have issues with transportation upstate. We have issues with childcare, all those things. And my concern, and I just want to allude a little bit about what Mr. Smith said, is if the National Academy of Science project, I'm going to actually ask Dr. Meyer this question because you alluded to it earlier. What could you describe it? I know this is not an easy question. Some of the failings and how the National Academy of Science has reported on this poverty measurement that we're talking about with this chart on dealing with the supplemental poverty measure versus dealing with the official poverty line, and how it'll impact states like New York, where we have this huge difference between New York City and upstate New York.
So the supplemental poverty measure and the National Academy of Sciences report, as Dr. Corinth has emphasized and other panel members have emphasized, would really shift where we say the worst off are, because it relies on what people are able to spend on housing in different areas. Even though one of the ways that people can end up spending more on housing is they're just better off. They have more resources. That it uses that to figure out where we should direct resources. And kind of perversely, well, more than kind of.
Perversely?
It directs more resources to where people have lower mortality, better health, are able to spend more on food, have higher housing quality, have higher education, have more assets, have more long-term income if you look at their income over many years, have more appliances. Basically, in our research, we looked at everything that we could get our hands on.
Well, let me ask a quick thing, just because we have among the highest Medicaid rates per capita in the entire nation, by far.
Yes.
No one's even close, not even California. I think Alaska maybe, because of the difficulty in navigating the terrain there. I mean, what's the impact? That must have a huge impact when you're talking about the SPM, or the Supplemental Poverty Measure.
Well, it turns out that Medicaid doesn't even enter the supplemental poverty measure. It probably should.
Because the rate is so high, though, in terms of determining the poverty rate. So how would wouldn't that exacerbate the issue that we have?
Sure, it would make it harder for, if it were then used to determine eligibility, it would make it harder for people in rural New York to get on the Medicaid program, because it would lower
The threshold.
the thresholds.
Let me ask a quick question, Mr. Hansen. I love the work that you're doing on trying to get people back to work. And I just wanted to ask you about if we increase the amount of tax credits without a work requirement, what kind of impact is that going to have on employers? Because I'll tell you, the number one issue that I face every single day in my district is that we can't find people to go to work, and employers are willing to give bonuses, free childcare, pay 100% of health care. Can you tell me what you think that would do, and if you think it's a bad idea to remove the work requirement?
So, Representative, what we offer most is the training to get into those kinds of jobs, because I bet the employers that you're talking about, generally speaking, are talking about a higher demand in terms of jobs. And for the people we work with, that's a choice they have to make. So in a rural community, you went to the same high school where your parents went to and where your grandparents went to. And, there's no choices along the way. But when we want them to take an extra step and to get more training, that's a choice. And so incentives make a difference on the margin. There's many for whom it doesn't, but there's very many for whom it does.
But would you say that it's better to have incentives to go to work as opposed to incentives to stay home?
Better to have incentives to go to work, yes, absolutely.
Thank you. I appreciate it. My time's out. Thanks, Mr. Chairman.